Hello again, everybody. My name's Meg Grudeski, and we're here to talk about how we might select a therapist, which I'm very excited to do because I think it's a conversation we don't often have. And I am excited to be a part of it because it means you might be considering prioritizing yourself. So I'm very excited. Awesome. All right, we're going to kick right in like we always do. So in the presentation or in this information session, I want to talk a little bit about what is therapy to give some context, go through some definitions of the different flavors of therapists, discuss things that we might do before intake, discuss things that we might do during our first session, have some ongoing check-in scaffolding information, a little bit about how referral processes work, and then also just some general important information. I want to offer the caveat that this is obviously my own particular viewpoint information and that someone else might give you different guidance, but this is just a starting point to initiate discussions. So what is therapy? Well, the shortest answer I could come up with is that it's many possible things. And I want to offer the condition or the permission for it to not have to be about a crisis. So I think often when people talk about oh, I'm going to therapy, people assume that some very big emotional, evocative, difficult thing has happened, which may be true. But also sometimes people initiate therapy for any number of different reasons. And so it's just a permission to say that you don't have to be in a crisis, that we are not taking away time or energy or effort from other people if we're working on stuff that we might not assume is as big a deal as other people's stuff is, because everyone's individual and everyone's place and space and need is different. For me, and again, my viewpoint, therapy is about opportunity. So it's an opportunity for us to prioritize ourselves, to have that undivided attention and care and input and reflection from another human that's completely focused on us. It's not a very commonplace thing to be the focal point of attention or conversation or effort. And so therapy is an opportunity to really prioritize ourselves for that time to work on the things or to explore the things we might be curious about. Therapy is often about healing. It's often about opportunity for us to find new ways to deal with stuff that we've had to navigate. It's an opportunity for us to heal from things that we have found difficult, or to heal from ways that we have been sort of distant from ourselves. And that, I think, is a very powerful, cool tool to exercise in this space. Therapy is often about learning. We're either learning new skills or strategies, or sometimes we're learning a lot about ourselves, or we're learning about emotional processes or brain processes or how most humans might make sense of the world. It's an opportunity for knowledge growth, and that, I think, is a very cool thing too. And also it's about practicing skills. So sometimes you might get a nice, tangible, new strategy on how to deal with a stressor or a situation. But in other cases, it might be about practicing vulnerability or practicing challenging or conflict resolution or whatever. And all of that happens within that ideally safe, supported, connected space that you create with your therapist. So the broad answer is it's all kinds of possible things. And I think the more important answer is therapy is whatever you need it to be. So oftentimes people get this assumption that they'll arrive at therapy, people, the counselor, the therapist, whoever, will tell them what they need to do and we'll go from there. But actually therapy is really about the individual, that person, and what that individual you might need to get out of those sessions and conversations. Want to talk about the differences and definitions of the various ways that we title therapists or therapy. And so I'm going to kind of go through these each individually as kind of a contextual space or an opportunity to learn the different flavors of how therapy can operate. So in general, therapist is sort of the overall term that gets used for any professional person who's engaging in this process. So in a way, all people, professional humans who are engaging in therapy can be called therapists. There are definitely more specific terms, or there are ways in which we try to limit the application of that. So like you might tell your hairdresser a bunch of things, but they're not actually a therapist because they're not engaging in the therapeutic process in the intentional way in which we do that. They may provide lay therapy, as we refer to it, and you may view them as a therapeutic person, but like, I don't think any of them would flag themselves as a therapist. So generally, people who use the term therapist are professionally trained humans who are engaging in that emotional process that is whatever the therapy between those two people looks like. More specifically, the term counselor applies to folks who have a master's degree in a relevant counseling or therapeutic field. So sometimes a social worker might be a therapist or a counselor or whatever that might look like. Usually counselors are registered with a governing professional association, and that is so that there is a code of ethics that we can reference as a way to ensure that we're providing similar levels or similar standards of service. So in Canada, one of the largest governing bodies is the Canadian Counselling and Psychotherapy Association, CCPA. So most often counselors are registered with the CCPA as a way to say, here is the like clinical standards that I am trying to adhere to and uphold. There's a degree of like accountability, or there's a degree of sort of like professional repute that comes with having engagement or enrollment in a professional association like that. And counselors, for purposes of billing, may or may not be covered by benefits and insurance. And that has to do specifically with the fact that they are part of governing associations. So very quickly, a governing association says, here are the like guidelines that you should follow so that you're doing good work and you're providing a standard that is ethical, but there's not the same degree of recourse. So if there's a complaint that gets filed against a therapist through a governing association, there isn't the same kind of disciplinary potential that exists if you are part of, say, a regulatory body. So these are kind of like nuances. All of it is to say, counselors are very educated, intelligent, trained humans. They may or may not be covered by benefits insurance simply because of the like rigor of being governing versus regulatory. Anywho, psychologists are folks who have a master's degree or a doctorate in relevant counseling or therapeutic field, same as counselors. They are registered with regulatory bodies. And the difference, very quickly again, is a regulatory body has a standard of practice and practice guidelines that are enforceable, as opposed to aspirational or guiding. So being a psychologist or being part of a regulatory body means that if there's a complaint that happens against that professional, there's actually disciplinary recourse that can happen. There is opportunity for clients to hold people to account if there are things that go on that need to be brought to attention or to be reconciled. And so there's an additional level of professional rigor that happens in psychologists' registration process. Most often, psychologists and counselors have very similar educational training. Psychologists go through an additional process of supervision hours. They have professional examinations and ethical examinations they have to take. And so there is, again, just like an extra level of accountability and standard that goes into that. Psychologists then, because of this, process and rigor, are able to diagnose, assess, and also provide treatment for mental health disorders. So a counselor is able to give you information about how you might manage depressive symptoms. A psychologist is somebody who's going to be able to confirm that you meet diagnostic criteria to have a diagnosis of major depressive disorder or whatever it looks like. So there is sort of additional privilege that comes with some of these processes for psychologists. And because they are part of regulatory bodies, insurance companies feel more confident in the standard that they deliver as therapeutic service. So very often psychologists, or almost exclusively and for always, psychologists are covered by people's benefits insurance. So just as a kind of note in people's lives. And then finally, psychiatrists are also one additional realm of this mental health treatment team. They have a medical doctorate with a specialty in psychiatry. They diagnose and treat mental disorders. They also have the additional privilege of being able to prescribe medications. Psychiatrists are generally covered by healthcare in Canada, and they also generally require a specific referral, meaning you can't usually phone up a psychiatrist's office and ask to have an appointment. You would have to be referred in through your family physician or other process. That is particularly true for us here in the Yukon, and that may or may not be true in other jurisdictions. I can't speak to those places, but often psychiatry or psychiatrists have an additional layer of referral that is required. So again, just a quick review. Therapist is the overall term for people who are engaging in therapy with clients. Counselors are folks who are going to probably be focusing on overall well-being. They are going to be able to provide psychoeducation about topics and concepts and skills, and they're also able to help practice those skills and to give tools and strategies to individuals. Lots of amazing counselors exist who choose not to engage in additional process of psychology. And just because someone is a psychologist does not mean that they are better at therapy than a counselor would be. So at no point is there sort of a guaranteed success hierarchy. I don't prescribe to that myself either. Again, psychologists are going to be able to provide counseling. Not all psychologists do therapy either. But psychologists can do the counseling, and then they have the additional layer of being able to diagnose and or do assessments. Again, being able to give more detailed information and with additional privilege from their process. And psychiatrists generally are folks who are diagnosing and managing medications. They may provide some assessment. Usually psychiatrists don't do as in-depth an assessment process as a psychologist would. Not to say that that is not true all of the time, but that is in general the recent experience I have, simply based on case management and time and those other pieces. And sometimes psychiatrists will engage in therapy. Again, from my experience, not as commonplace in other jurisdictions, say. So hopefully that gives a bit of an overview context of some of those pieces. And there are pros and cons to accessing each of these different types of therapists or professional in mental health. And it really comes down to what is your individual need and or what are some things that you are seeking. We're going to get into that in a minute. Okay, so before intake, which I want to just say, if you're considering engaging in therapy, that's exciting. And I'm very proud of your prioritization of self. And so before you engage in the intake process, there are a couple of things that I just want to highlight as a way so that you feel most successful in that endeavor, and also to hopefully give you the greatest opportunity to be successfully matched with a therapist so that you may not have to go through this process multiple times. So before intake, considering what is your reason for wanting to seek out counseling? What are some of the goals you're hoping to achieve? What are some of the desired outcomes that you're wanting from this process? And also, how might you determine what is successful? So sometimes therapy might be labeled successful, but it may not be meeting the goals that you're hoping to achieve. That may or may not fit with what you're kind of wanting. And I also think it's perfectly fair if you're not entirely sure what you might want to be working on, because you maybe are hoping to entrust that person to help guide you through that process. But usually when we're engaging in therapy, we have a couple of ideas of things we might want to chat about, if for no other reason than to have a sort of launching off point with our person. decide on some of the key topics you want to discuss with that individual, because that can actually help determine which therapist is maybe a better fit. So if you know that you want to talk about depression and social anxiety and managing a phobia of sharks in the swimming pool or whatever it is, being able to know what those kind of broader topics are means that you're going to be able to ensure that you're matched with a therapist who has knowledge, experience, and confidence in treating that particular thing. So if you're like, I'm not really sure why I'm here, and then later you come with more specifics, it may impact the success of that match, because maybe that person is very good at topic 1, but not topics 3, 4, 5, and could have maybe matched you better with someone who was going to be able to help you more fulsomely. So again, broad topics is kind of the piece of it. If you know you want to talk to people about family addictions, then you know you're going to need somebody who has experience in family therapy and also with addictions therapy, and that will help determine who's going to be your best therapist. Thinking about what kind of therapist you're looking for, and this will sound strange, but like being specific about the people you feel comfortable around or the people that you feel willing to open up to. So doesn't matter their age, doesn't matter their gender, doesn't matter what therapeutic modality or training or process they have. Does it matter where their office is located or what you can expect when you arrive at their office? Does their price matter? All of those things are important questions to consider. And it is solely because we want to ensure that people have success. So if, for example, I want to go in and have conversations about difficulties I have with my family, I probably am not going to feel comfortable talking to a therapist who reminds me of members of my family. So there may be parameters or characteristics of that person that are like not changeable, but may impact. And I get to give advice, or I get to give input on who I might feel comfortable with. Maybe I'm not comfortable seeing a female therapist, or I'm not comfortable seeing a male therapist, or I'm not comfortable seeing an older or a younger person, whatever that could look like. Based solely on what I know is going to be best for me, I get to have those indications. So as much as it is good to kind of know who you might like, it is also important to know who is definitely not your fit. And sometimes that's more valuable. So maybe we don't know exactly who we want, but we know for sure who we're going to feel uncomfortable with. And that is important information. And it isn't to say that that person is not a good professional, but humans are social creatures and we make connections based on our comfort level. And so I'm not everybody's favorite flavor of therapist, and that has nothing to do with either of us being judgmental people or anything like that. It's just we're not the right fit, and that's totally fair and fine. And we'll talk more about that in a minute too. So I want to also just remind in this moment that therapists are sort of shoppable. You can shop for your therapist in that they are the same as any other fee-for-service provider. So you would ask around for referrals if you were going to a new mechanic, or you might shop around to find who is your best hairdresser or massage therapist or contractor or whatever it is, because you are engaging in a professional service exchange, and how that person is in the world or who they are in the world is important, because it's going to impact your success. And so often I think we arrive at this conclusion of like, oh no, that's the person that was given to me and I have to kind of accept that and I can't make change with that. And that is untrue in therapy. I know that there feels a lot of levels of pressure, especially in medical professions. You know, if you get assigned a family doctor, it's really hard to say you don't like that family doctor because there's not a lot of availability. But it's important that we recognize that we do get to kind of shop around for people that we feel comfortable with. We can determine who is our best people. So you can interview therapists, and I am going to make a very strong argument in a moment about why you should interview therapists. It's again, I think, more just a permission to say you're allowed to do that, and I encourage you to do those things. And you can ask questions of them to make sure that they're the right fit for you. Point of clarity, the majority of the success in counseling is about therapeutic rapport or the therapeutic bond. And that is actually close to 70% of reported positive outcomes are based mostly on, do I feel comfortable with that person? Do I like being in their presence? Do I feel supported by that person? And less to do with how much knowledge or competency or capacity that that professional has, which I joke about feels unscientific in that, you know, many of us who get into therapy have gone through a pretty rigorous process to gain education and knowledge. And it really comes down to, do you want to hang out with me for an hour and talk about some like heavy shit? Which is cool because, again, we're social creatures. So we get to make those determinations. And then finally, just thinking about before intake, what do you want to know about them? How will you know it's a best fit? What is the decision-making process you have for that? So sometimes people arrive with sort of a checklist of like, my therapist will be XYZ, and that's great. You should be as specific as you need to be. Sometimes people arrive being like, I will know, or when I feel it. Like, we go more on an intuitive decision-making process, which is also totally fair. So just figuring out which is yours. Okay, before intake, also lots of homework before you start therapy. Hey, everybody. I would encourage you to research your potential therapists. And I say this with the caveat of if that's possible to do. So for example, if you're going to access one of the free services here in Yukon, you may not have opportunity to be as selective, or you might not have as much autonomy in that choice initially of who you get matched to, because they're matching people to caseloads and availability on caseloads, with, again, some conscious effort to make sure that people are going to fit. But you may not be able to research your therapist, or you may not be able to request your therapist initially. So there's an opportunity to say, like, if you can, read their website or read their biography or ask other people about them, please do that as a way for you to kind of gather information and get a sense for yourself of, could that be the right person for you? Maybe you can like watch webinars that they host and you get a bit of sense of their vibe. Maybe you have opportunity to talk to people about them, whatever that looks like. I would encourage you to also make use of the intake counselors or the intake process that people have at their office or their agency. It can be super beneficial in assisting to determine who might be a best fit for you. And that's also an opportunity for you to ask some questions about that therapist you might be matched with. So intake counselors, or the folks who provide intake support, generally know everybody on their team. They're generally very familiar with like the issues and the styles that the therapists offer, and they want to ask questions that pertain to making sure you match well. So please be candid with that intake counselor about the things, and also feel free to ask for clarification, or if you get matched with somebody that you're like, well, I don't really know, and I think I might like to try someone else, you can make that request of that intake process. You can also ask for a consultation. So sometimes therapists will offer like a 20-minute phone call where you can get a sense of who they are and how they operate. And that can be really beneficial for you to have opportunity to ask a couple of very direct questions about things you need to know about them, or provide you an opportunity to have a like, you know, conversation to get a sense of, do you feel comfortable or confident in that person? So you can ask for consultation. Caveat again is maybe it's not always available, but we can always ask for things. And there's always opportunity for us to like navigate that in those moments. So encouraged to do that. Okay, so you have participated in all of this preemptive information as you're trying to select what your therapist or who your therapist might be. What can you do in the first session to feel like you're having a successful go of it with people? So my advice is to bring a summary of the things you would like to share with that person. One, because it helps determine you're the right fit, because you're going to give them preemptive information about what you want. And also it helps to keep thoughts organized. I'm sure all of us have gone, oh, I only need a few things from the grocery store, I'll totally remember them. And then when we arrive at the grocery store, we're just like, sugar and spice, what is it, the things that I needed? And we have that moment. Same is true in therapy. So I would encourage you to just make a jot note or some jot notes of the things that you want to highlight. And again, as a way to kind of give a quick overview of who you are and if they might be a fit for the things that are going on for you. Bring a list of the questions you would like to ask them. And in the next few slides, we're going to talk about some of my suggested questions to ask therapists. So we'll go through that in a minute. And then again, also be mindful of how will you decide they're the right therapist for you. So what is your kind of, this could be my person or not my person criteria? Because it is good to kind of know how you will know if they're a fit or not. Okay, the meat and potatoes fun time of the questions you might ask your therapist. And there are a lot of them because my brain is enthusiastic. And also, please don't feel like you need to ask people all of these questions, but you may decide that there's, 2 or 3 from each of these categories that you might be most curious about. And I would encourage you to ask those things. So my first category of questions is asking them about their office and the administrative process that you're engaged in. So some examples. How did we get matched? Might be nice to know how they were, it was predetermined that you would be the person that they sit with. How do they determine fit with clients? So do they have their own evaluative process? Do we always meet in this particular office? Because sometimes we get comfortable in a space and it might not feel as comfortable if we're in a different room. Brains like predictability, so ask about that. Are we limited to a certain number of sessions? So in the cases of some, free services, you might be limited to 10 or 12 or, 16 or however many sessions as part of their mandate. So it's good to know that in advance. What's the billing process? Do you have to pay immediately? Do they send you an email? Do they take credit card information? That's always good to know. Are they covered by insurance benefits, or which insurance companies do they have relationships with? How frequently will we be meeting? Because, perhaps some therapists are able to meet once a month and other therapists have more flexibility. You have to know, or you have to have an idea of what you think you want from them. What is the referral process if they aren't a fit? Because that is another good preemptive question to ask. How do we know we're the right fit for each other, and what do we do if we're not? There should be some answer to those questions. What are important policies that you need to know from them? So confidentiality. In a small community, in a small town, how do they manage dual relationships, information sharing, how do you cancel appointments, how do you schedule appointments, all of that stuff. I have added in specifically the question of how do they manage dual relationships, because we live in a small town and we're going to see each other at the grocery store, or we might learn that our kids are in the same hockey pool, or we might learn that we share a friend in the periphery. So how are we going to navigate that when we have these multiple points of contact? Excellent question to ask a therapist, because we need to know that. Asking if there needs to be preparation for sessions, or asking what their expectations are between sessions. Some therapists are, they might assign homework, or they might have check-in reminder things, and some therapists don't. So being able to be clear about those pieces. The next category of questions you might ask this person about is about their training or their work or their therapeutic process. And again, we don't have to ask all of these questions, but some of these might bounce out or stick out more for us as things we'd like to know from our therapists. So how long have they been practicing? Is that important to you? Do you need somebody who has lots of clinical experience, or do you feel comfortable trying out somebody who is relatively new in their practice? Are they part of any professional registrations? Again, it gives a bit of context of their level of education or their level of professional engagement. For me, I don't know if it matters which ones they're assigned to. It might be important to you. Personally, I think it's important that people are registered with some professional association so that you have opportunity to check in about what their ethical standards are, or what the sort of standard of care that you can expect from that person because they're following a set of guidelines. That would be the reason for that question. How often do they seek supervision? Are they consulting with other professionals about their professional life, or are they kind of flying solo? Get them to describe their ideal client. And that has more to do with, I think, characteristics people are seeking in therapy than this particular demographic of client. So as an example, my ideal client is somebody who's curious and somebody who is wanting to engage in the work and somebody who is willing to have discussion about how that all looks together. It's more a collaborative person. I like clients who want to have sort of back and forth. I'm not really great with clients who are asking me to like give them stern direction. So that's a nice ideal client question to ask. You know, asking them about their general process. Are they directive? Are they guiding? Do they assign things? Are they more free form? What is their preferred modality? So often therapists have a particular school of thought or a particular like theoretical orientation, and there are many pros and cons to all of those different ones. So asking that therapist where they're coming from and why they've chosen that one is a good way to get to know them, and it also gets to know about their process. What interventions do they use? How do they work most collaboratively with clients? What's the process for determining how you work with clients? Because sometimes we know we need to work, but we might not have a direction. How do you set goals? How do we know we're having success? What are the issues that they have the most experience with? How do we know we're making progress? These are all questions we want to know so that like we have some confidence that they're aware of when things are going well or when we're moving forward in our goal progression. How long do you expect it before we notice that there's a change? Have you worked with people who are dealing with similar stuff as I'm dealing with? What is your experience with something specific? So if you have a really specific query, ask them about that. And that's an opportunity to just be very candid about what you need from them. So like, for example, you know, if you're a queer person, you want to make sure that that therapist has experience supporting queer people. And if they don't, are you willing to help with some of their training and their knowledge base and growth, or do you want to pick somebody else? Those are all fair questions. How do we think therapy can help? That's a fun question to talk about. And what's their preferred way to be shared with that information or things might not be working? Again, I think we forget that we have autonomy in those therapeutic relationships. And if things aren't going well, we get to talk about it as clients. So what is their preferred way to receive that information? It's a very cool question. And then finally, we might want to ask questions about them specifically. These are my flavor of questions I'd want to know, and you may have different ones. So like, what made you want to get into therapy, counseling? Why do you want to do this as a profession? Do you go to therapy yourself? That's an important one for me because I want to know that people are working on their shit too. Do you use self-disclosure? How do you decide what you're going to share with me? Am I allowed to ask you questions? And the answer is yes, you can ask questions. Not all therapists will answer them, but I would encourage you to get into that. What is the degree of sharing we can engage in? And how do you want to receive feedback? Do they want an email? Do they want to have it as a conversation point? Basically, any questions about what do you need to know so that they know or that you know that they're the right human for you, and then ask those questions. So it might be one of those things where you're like, I need to know that that person is a dog person because I have a, you know, very close relationship with my dog and I use them as a support and I want them to kind of get that. That's a fair question to ask. And it can be as sort of easy as that. You don't have to ask like super big, invasive questions. They can just be like, I need to know that you like dogs, or I need to know that you, I don't know, go fishing, or whatever it is, as a way to kind of get a sense of what you're going to feel comfortable with. So those are some of my example questions. And again, you do not have to ask all of those questions in the first session or ever, but you may have found a couple of those that you're like, hey, I would be really curious about asking my therapist that question. And if you are already engaged in therapy with someone, you can go back and ask those questions at any point. It's not like you only get to ask them the first day. There may be things that come up that you need to know about your therapist, and you can make requests. Again, I add the caveat of not all therapists may answer them. Some therapists are very protective or rigid about their self-disclosure, and other therapists may be more casual or more open to it. My overall theme for therapy is like, we can talk about it or we'll talk about it. And if we don't want to, we'll talk about why we're not talking about it. So there's opportunity for discussion nonetheless. I want to talk about ongoing check-ins to make sure that that person is still the right person for us. Because sometimes we may experience moments where we're like, I'm not sure that this is still working for me. And we get to talk about those things with ourselves or with other people. So for me, these are, again, some questions that I like to internally check in with myself about as I'm going through therapy with my own therapist. But also, I would be really hoping that some folks are doing some of this self-reflection. So how do you feel when you're with that therapist? Do they feel authentic? Do you feel empowered or do you feel examined? Again, is it from curiosity or from like an inquisition lens? Because that makes a difference to how people approach things. Do they listen well to me? So sure, maybe they're like quiet and they are hearing all the things, but are they actually listening in a meaningful way for you is a bigger deal than sure, they were quiet while I talked. Were you surprised by anything that came out, good, bad, or otherwise? Do they overshare personal details or did you feel like they overshared that day? Did it feel scripted? Was it a good use of my time is one of my favorite questions because I might not have had a session that I expected to have, but maybe it was actually a very good use of my time because I learned a new thing or we had a new challenge or whatever. What are 3 things I would say to a friend about this session? That's one of my favorite personal reflection questions is like, what is the way I would describe that last bit to somebody else? Because that will be a helpful way for me to determine if it was a good use of my time. Do they feel trustworthy? And then finally, and maybe most importantly, like, do I want to come back? Because sometimes therapy can be hard and icky and difficult. But usually you want to return to it because you feel like you've gotten something out of it or there have been valuable moments. If you feel like I don't actually want to come back and that wasn't a good use of my time, then that might be like an ongoing check-in point where we need to have conversation with the therapist about a referral or about a reevaluation of therapeutic goals back to the beginning kind of thing. So in that vein, I want to talk a little bit about what a referral process might look like. And so I want to just offer up that like, just because you start seeing a therapist and you have success with a therapist, or maybe you don't have success with a therapist, does not mean that you have to continue to see that person. So you get to be empowered and you get to have autonomy about what that looks like. Just like if you like got a bad haircut from someone, you can decide never to return to them for a haircut. You may choose to offer them feedback about why that didn't go well or give them an opportunity to like correct or support, or you may decide I'm going to just see a different person, and all of those are fair options. Same is true of therapy. Maybe there's an opportunity for you to be like, that did not go the way I wanted, or that did not go well, and I'd like to talk about it. Or maybe you might decide that's a whole other situation I don't want to get into. And so there are numerous ways we can address this. So for me, the first question in the referral, like maybe I don't want to see that particular therapist anymore, is do I feel comfortable discussing that with them? So honestly, that could be seen as an opportunity for both parties to advance their knowledge or their capability or their capacity. One, as a client, it gives us opportunity to challenge and keep accountable professionals. And as a professional, this is a welcomed opportunity for me to either be accountable that things are not going the way that person intended, or maybe I get to learn a new thing or practice a new skill or receive new feedback. That might also be a point of conversation if we're willing to discuss referral with that counselor we would like to no longer see. They might have insight on who could be a good referral for them or for us as clients. So again, they know us, they've learned things about us. Maybe they are also feeling that we've kind of reached the, precipice point of the two of us together. And they may know somebody who could be really awesome about the things we could need. So that's an opportunity to also make sure you're getting another good referral to a new place or a new professional. So why are you looking to be referred? So are you comfortable talking to them? Yes or no, maybe some conditions. Why are you looking to be referred? So is it that it's no longer a good fit? Like, and maybe that's true. Maybe we've reached the, end of both of our knowledges together and that's okay. Or maybe we feel like it's a, opportunity to try out a new person to see how fit is, whatever. Is it because things are not going as you expected? And do you feel comfortable reassessing them or redirecting them back into more of what you want from this process? Because that's an opportunity for everyone to learn. Or did something big happen? So sometimes we might want to be referred to a different therapist because something happened and we feel like there's kind of been a rupture and we're not sure we can come back from that. And I'm going to talk about, some of the human factors of that in a moment too. But like maybe something happened and we've just kind of changed our opinion or our comfort or our whatever with that person, and that's okay. Do we feel comfortable talking to them about it? Or do we need to just not? And if it's something that's so big and potentially so difficult that like, do we need to maybe report this to that person's governing or regulatory body? So can we hold to account this particular big thing that happened if it is not feeling comfortable? And the answer is yes. You can always make a complaint to your person's professional body of whatever capacity or flavor they're registered with. You can do that anonymously, and they should explain to you the process to do that. Or again, if you've asked the question of who are you registered with, then you know where to start that complaints process. So all of those things are true, and all of those things can be a reason why you'd like to be referred to somewhere else. And if at any point you have follow-up questions about that, happy to provide support or answers, or Google, I'm sure, will help guide all of those pieces too. And then finally, kind of another part of this question is like, what kind of referral are you looking for? So do you just want to see a different counselor, or do you need to be referred to a different category of mental health professional? And that can be true of all kinds of reasons. Is maybe you've been seeing a counselor and you realize you need a diagnosis, or you're more curious about a diagnosis. That means you're going to have to see a psychologist or a psychiatrist. Maybe you've been working within a diagnosis that a psychiatrist or a psychologist has given you, and now you're looking to discuss medications. That might mean you need a referral to a psychiatrist. So like, you might need to kind of move up this like imposed hierarchy, not because people are better or better trained. It's just that we have different skills or duties or capacities that we can offer people. So what is the referral you're looking for? Also will maybe help that person, if you're comfortable and willing to let them be part of that, help you with the success of that next step. So I want to talk about some important information as it relates to sort of like that big thing happened, or just in general. So the first point is like, therapists are people. They make mistakes, they have off days, and they are also wanting to be as best as they can about that. So I'll speak from my own perspective. I don't always get it right. Every session is not always my most amazing best session, because I'm also a human at the core of this. And that is both an advantage in therapy and also a disadvantage, because I have got my own flavors of shit going on too. And sometimes that is helpful and sometimes that gets in my way. But being able to just acknowledge that like, therapists are also people, which means they are willing to be people with us, alongside us. And it also means that they're not perfect. So sometimes that's an advantage, is being able to like move through mistakes and to practice conflict and to practice discomfort and to repair relationships in a controlled space that way. And sometimes we might be like, this is actually not what I want or need, and I don't feel comfortable anymore. I might need a referral. And again, if you feel comfortable discussing with that person, you're probably going to improve their practice. And it's also okay if you just send an email to say, I'm going to go see someone else. And it's also okay if you don't do any of those things. Again, to tie into this final point I'm getting to, professionally, we'll figure it out. They won't be offended. So the second thing I want to highlight is that like, therapists want to help. And if it's not with them, they want to continue to see people accessing therapy so that they can get to their best version of self. And I say this to clients all the time. I would way rather you continued in therapy with anyone else than to never continue at all. And if I can help with that process, I want to. But I also understand that it's maybe weird that I might help you in that process. So I'm on board with whatever that person needs. And again, therapists get into this profession because they're caregivers, and because they're curious, and because they have lots of, empathy or space or, desire to be helpful to other humans. And again, I'm not everybody's favorite therapist, or I might not even be everybody's best therapist. And I would way rather people continue than stop entirely because of an experience with me solely. So that's my caveat for that. And then finally, I just want to say, like, I think often we are afraid to offend other people, or we're afraid to offend people because we don't want to hurt anyone's feelings. And that's lovely because we're nice. But also, therapists, this is part of a professional thing too. It's good practice to support clients. And if that means it's no longer with us, it's still good practice to support clients as they find new therapists. And if that person's offended because you've asked for a referral or you're not coming back, well, that's just a major reflection that they're maybe not a good fit for you anyway. And I say this from, again, my own personal experience of, I might feel like I could have had opportunity to repair a relationship, but at no point am I going to be mad if people are seeing a different therapist, because again, I want them to have good service. I want them to feel connected. And if that's no longer with me, that's great if it's with somebody else, because that's, again, my preference. I'd rather people continue than never return. So hopefully some of this answered some of the questions, or at least given you different food for thought or different things to consider. Is a lot of information for me to like give to, but also I think helpful information. And again, reference back to those questions if at any point you'd like them. So just a quick little, here's my information. If you have follow-up queries, or if you'd like a copy of that list of questions, you can shoot me an email and I can help you out with that. So yeah, I hope you engage in therapy. I hope you find somebody that's a fit for you. And I hope that you continue to be awesome. So thanks, everyone.